And as you can see, this is our 6th annual IPE Day.
The Director of Interprofessional Education summed up why a panel and nearly 300 students were gathered on IPE Day to share knowledge across disciplines.
A deep commitment to interprofessional education and practice can both inform and truly transform the care that we give to our patients and their families.
The transformation described by School of Nursing Dean Jane Kirschling had materialized on stage. A school alum who is the mother of 5 told of care that she and her son received at the President's Clinic from nurse practitioner Elsie Steins, gastroenterologist Jay Perman, and an interdisciplinary team.
It was hard for me, but when I walked into the room, I saw the nursing student, I saw the doctors, the social worker, the nutritionist, the physical therapy, the dentistry school student, and I was like, oh my God, thank you God for this, because I was lost. As a mother, seeing your son laying in the bed, telling me he's not gonna make it, it was hard. And when I met all these wonderful people that day, I went home and I just started crying with Oscar, telling him, I think we're gonna have hope. And I really, 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 really thank all of you for what you're still doing for us. Really, thank you, Oscar. Say thank you, right?
Thank you.
Enter another patient, one Dolores Darling. She's portrayed by an actor to show why students at this breakout session need each other's skills to best diagnose and treat her diabetes.
Are you on anything? Have you talked to your doctor if you have a doctor?
And I'll ask about if you've had any problems with dentition, pain, how were your latest HbA1c levels?
Is it safe to assume that because she's diabetic that she knows what the HbA1c levels are? Because if somebody asked me that,
Or you can ask blood glucose level.
So the first thing I want to ask you is, aside from diabetes, do you have any other medical problems, like any cardiovascular disease, like heart disease, any of that?
No, no one's ever told me that.
What kind of medications are you on?
Well, I take metformin, and I was supposed to be taking this other medicine for, it's like a Juby or something like that, but I didn't take it. I've never taken it because it was too high. The price was too high.
Now, does your insurance cover everybody in the house, the insurance you have through your job?
That's the cheapest insurance I have. It doesn't hardly cover anything.
Have you seen dentist lately?
No, I haven't.
When was the last cleaning you got done?
A couple of years ago.
So we know you said earlier when you got your blood pressure taken at the fair, you had the nurse take it on. Which arm did you say the nurse had taken it on?
Well, the right arm.
Okay, so your left arm.
Because with my left, yeah.
Okay, can you tell me a little bit more about that left arm? So you said it wasn't pain, but kind of what was feeling?
Well, it was a couple of days before I went to the fair. I had went to do some grocery shopping. And then I noticed that I had this like numbness from here all the way down to my fingers.
Okay.
And I was feeling a little clumsy. It wasn't quite myself. And so I sat down for a few minutes, maybe about 15 minutes, and I was okay.
With the patient interview complete, students confer in small groups to devise and then deliver Darling's treatment plan.
Her creatinine's high, and that's renal function. And so diabetes does affect renal function, hypertension can affect renal function. It's not terrible, 1.2 is not awful, but it's an indication that we may have a concern there. So thinking about medications, we would also want to target something that would give her renal protection.
We can ensure her that we'll obviously take into her financial situation. We'll take that into account. Look at, the generic $4 list, make sure that whatever we give her is going to be something that, it might not be accessible to her, but we'll try our best to make it the most accessible option.
There are a lot of food pantries at local churches, but they just don't have the healthiest options.
Okay.
And sometimes I don't know if it's in Baltimore County also, but I know in Montgomery County where I am, there's a program called MANNA, that has food for patients that have difficulty affording food, and you can get a diabetes box where it's specific food to kind of be more appropriate for a patient with diabetes.
Thank you for coming back. I know getting back and forth to the doctors can be pretty tough.
Yeah, because I can't afford to be spending a whole lot of time leaving work because that means no pay.
And what that shows us is your health is a priority. So we did get some labs last time, okay? And your blood pressure at 190 over 98.
Is that really bad?
So that's pretty high. So I have the pharmacist is going to talk about how we can offer some help on the medication standpoint. Would you be interested in trying a new medication?
It's going to cost a lot of money.
And that's what we have the social work to help us with that. So we have some ways to get around the money aspect for the medication. And we're going to do our part to make sure you can get the medication to be able to help your health.
So the two main issues that we want to address for you today is to get your diabetes under control, and we want to get your blood pressure under control.
Do you have anything that it can check your blood sugar and the blood pressure at home?
No.
So we can work together along with your doctor to find affordable resources for you so you can check your blood pressure at home and at work.
We're all here to help you figure out a way to improve your overall health and decrease your stress levels as well. And we're here to help.
Next, it's time for takeaways with guidance from faculty members, the standardized patient, and to wrap up, fellow students.
I would have wanted you to ask me first my story, because if you had asked me, what really brought me in, I would have felt a lot more eager to tell you. I felt informed as to the reasons why my blood pressure was high. Not just that I had high blood pressure, but breaking it down in layman's terms as to why it's high and how important it is to keep it under control, how important it is to keep my diabetes under control. And when you ask me, how did it feel? What about this? Is this okay? Do you want to do this? Or how do you feel? Do you have any questions about what we said? So I'm also feeling I'm a part of my care, not just you're making decisions for me.
Every single discipline that was in there today did the same thing. They were asking questions about their home life and their stress and things like that. And it became very clear, especially with the feedback from the patient, that all of that stuff is probably more important to them actually adhering to whatever plan we come up with.
It was so easy to feed off of each other's energy and each other's thoughts to implement a treatment plan that was very patient-centered.
Andrew's the name, pharmacy's the game. So one thing I'd like to mention that wasn't already covered was the amount of respect that we all had for each other. Sometimes you don't know how it's going to be when you're working with a group of other disciplines, and at least in my group. And what I could see is everyone had a lot of respect for one another. No one was spoken over, and we took our times, and I think it really added to the experience.
The word that comes to my mind for how I felt was kind of freed. Freed to think about the stuff that I needed to think about to do my part of the work, because I knew that the rest of the team was going to be working on the other parts of the problem that I didn't know how to address. And that's a distinctly different feeling from how I often feel over in the hospital or in the clinics on my rotations, where sometimes we don't have such a great interprofessional team at the ready.
I think a big problem with this approach, and I think it's a great approach, the communication aspect. I think I value the one-on-one patient interaction a lot, developing that kind of interpersonal connection. When you have 10 people on one patient, that can kind of get lost. So I think there's maybe that little fault with this. I think the system's great, maybe doing it more individual, so having each person talk to them individually and then kind of go through the however many people are on the team. But doing it all at once, I think, might kind of crowd the patient, kind of hurt the interaction between them and the provider.
This kind of is a response to this, but I really value sharing information because there's some overlap, but we all have different scopes. And reality is, there are a lot of patients that have a team. We just may not be in communication with each other, but they come to see us and we may have that one-on-one time with them, but then they probably that same morning or that afternoon, they're on their way to see maybe their cardiologist. So it is important to have that cohesiveness and also to have a general understanding of how other disciplines can help. For example, social work, I did not know how amazing, you guys are great.
So was there any thoughts that students had from their discipline where they felt like the other members of the team they were on perceived their role incorrectly?
I'm a first-year NP student from the School of Nursing, and I think a big misconception is that because I'm from the School of Nursing, I fulfill a nurse's role. And although that is correct, I am an RN. NPs have the same train of thought as a physician.
There's always this perception that social work fixes everything. So like, you're the doctor, you've, prescribed the medicine, and then you're like, oh, you have all these problems, you don't have insurance, you can't go to the social worker, like they'll fix everything. And so like, yes, we do a lot, we help in a lot of ways, but we're also not like, we can't just do everything. There's some things that are out of our power.
I disagree. I think the social workers can fix all the problems that the rest of us can't fix, but that's just me. But that, at least for me, that's, I hope to find a place, whether it's across the street or wherever I end up, that is doing this, and hopefully we'll see more and more of it.